Welcome to today's presentation on contact lens care. For millions worldwide, contact lenses offer an incredible blend of freedom, convenience, and a clear view of the world without glasses. They've truly become an integral part of daily life, supporting active lifestyles and even enhancing appearance. However, it's crucial to understand that beneath this convenience, contact lenses are medical devices that, if not managed properly, can pose significant risks to your eye health. This presentation is designed to empower you, the contact lens wearer, with vital knowledge. We'll explore the full range of potential eye conditions and complications, from common irritations to serious infections that could lead to permanent vision loss. Our goal is to provide you with essential information on how to significantly reduce these risks, ensuring you continue to enjoy the benefits of clear, healthy vision for years to come. Contact lens-related eye conditions can be broadly categorized into two main groups: infectious and non-infectious issues. Both can impact your vision and comfort. On the infectious side, we have conditions like infectious keratitis and corneal ulcers, which are typically the most serious threats. Among the non-infectious issues, we'll first cover those related to oxygen deprivation of the cornea, known as hypoxia, and various allergic and inflammatory reactions that can arise from lens wearer solutions. Dry eye disease is a very common issue for contact lens wearers, as lenses can interfere with the natural tear film. Corneal abrasions, or scratches, can occur from improper handling or foreign bodies. We'll also discuss contact lens overwear syndrome, which is a chronic discomfort from exceeding wear limits, and corneal warpage, where the lens can temporarily or even long-term change the shape of your eye, affecting your vision. Infections of the cornea, the transparent dome-shaped front surface of your eye, represent the most severe complication of contact lens wear. These infections, collectively known as keratitis, can rapidly progress. If left untreated, they can lead to incredibly painful corneal ulcers, permanent scarring that affects your vision, significant vision loss, or in the worst cases, even necessitate a corneal transplant. It's crucial to recognize the symptoms: intense eye pain, significant redness, blurred or hazy vision, discharge, extreme light sensitivity, or the feeling that something is constantly in your eye. In severe cases, you might even see a white spot on your cornea. If you experience any of these, remove your lenses immediately and contact your eye doctor without delay. These infections are medical emergencies. Let's look at the leading causes of infectious keratitis. Bacterial keratitis is the most common type, often involving bacteria like Pseudomonas or Staphylococcus, commonly found on skin or in water. These can rapidly multiply on improperly cleaned lenses or cases, or when lenses are overworn, especially overnight. Fungal keratitis is less common but often more challenging to treat, occurring from exposure to fungi, particularly if lenses come into contact with contaminated water or plant material. Then there's acanthamoeba keratitis, a rare but devastating infection caused by an amoeba found in tap water, lakes, and hot tubs. It's strongly linked to rinsing lenses with tap water, using homemade saline solutions, or swimming with contact lenses. The contact lens can unfortunately act as a vehicle, trapping the amoeba against the eye, making this infection notoriously difficult to eradicate. Finally, while not directly caused by contact lenses, wearing them can exacerbate existing viral infections, like herpes simplex virus, by compromising the corneal surface. Moving on, let's look at other serious complications, starting with corneal ulcers. An ulcer is an open sore on the cornea, typically a direct consequence of untreated infectious keratitis or severe irritation. Symptoms include intense pain, redness, blurred vision, discharge, light sensitivity, a persistent feeling of something in the eye, and often a visible white or gray spot on the cornea. These are medical emergencies requiring immediate attention to prevent irreversible damage. Healing of deep or extensive ulcers often results in permanent corneal scarring, which, particularly if central, can lead to significant and irreversible vision loss by blocking or scattering light. Next, we have corneal hypoxia, which is oxygen deprivation. Our cornea is unique, it gets most of its oxygen directly from the air. Contact lenses, even modern highly breathable ones, act as a barrier, reducing this vital oxygen flow. Chronic hypoxia is caused by overwearing lenses or using older, less breathable lens materials. Chronic oxygen deprivation, or hypoxia, due to overwear or older lens materials can lead to several specific issues. Firstly, corneal edema, which is swelling of the cornea. This can cause blurry or hazy vision and discomfort, and persistent edema can contribute to ongoing subtle blurry vision. Secondly, corneal neovascularization, which is the growth of new, abnormal blood vessels into the clear cornea. This is problematic because these vessels aren't supposed to be there and can obstruct or scatter light, impacting vision if they grow into the central visual area. This is a progressive condition if chronic oxygen deprivation continues. Thirdly, corneal microcysts and vacuoles are microscopic fluid-filled pockets or debris within the corneal layers, indicating metabolic strain. These are usually asymptomatic to the wearer but are detected during an eye exam. It's also worth noting that long-term hypoxia can contribute to a gradual increase in nearsightedness, sometimes referred to as myopic creep. Your eye can also react to contact lens materials, deposits that build up on the lens surface, or even the care solutions you use, leading to allergic and inflammatory conditions. One common one is giant papillary conjunctivitis, or GPC, which is an allergic inflammatory reaction of the inner lining of your eyelids. This can cause cobblestone-like bumps to form on the underside of your upper eyelid, leading to itching, redness, mucus discharge, and making you intolerant to your contact lenses. Contact lens-induced acute red eye, or CLAIR, is a sudden, painful inflammatory reaction marked by redness and light sensitivity, often linked to bacterial toxins accumulating on lenses, particularly with extended or overnight wear. Finally, a general allergic conjunctivitis can occur as a reaction to specific lens solutions or materials, resulting in widespread eye redness, itching, and watering. Dry eye disease is a significant concern for contact lens wearers, as lenses can significantly contribute to or worsen dry eye symptoms. Lenses can interfere with your natural tear film in several ways, by acting as a physical barrier on the eye's surface, by absorbing moisture from your tears, or by altering the tear film stability. The common symptoms include dryness, irritation, a gritty or sandy sensation, and sometimes even excessive tearing, which is a reflex to severe dryness. You might also notice fluctuating vision, where your vision becomes blurry and then clears with blinking, along with a burning or stinging sensation. If dry eye becomes chronic and severe, it can even lead to surface damage on the cornea, impacting your vision quality and clarity over time. Let's cover a few more non-infectious issues that can arise. Corneal abrasions are scratches on the corneal surface, causing sudden pain, redness, tearing, light sensitivity, and the feeling that something is in your eye. These can occur from improper insertion or removal, a foreign body getting trapped underneath, or even a torn or damaged lens. It's important to address them quickly, as even minor abrasions compromise the eye's protective barrier, making it more susceptible to infection. Then there's contact lens overwear syndrome, or intolerance, a broad term for chronic discomfort often resulting from habitually exceeding recommended wear schedules or neglecting proper care. This can lead to persistent eye discomfort, redness, dryness, reduced wearing time, and ultimately, an inability to tolerate lenses for extended periods. Lastly, corneal warpage or distortion occurs when prolonged wear of ill-fitting or older, less oxygen-permeable contact lenses causes temporary or even long-term changes to the natural curvature of your cornea. This warping creates an irregular corneal surface, leading to distorted, blurred, or ghosted vision, even when lenses are removed, and difficulty achieving clear vision with glasses. While some issues like infections can cause rapid vision loss, contact lens use, especially improper use or overwear, can also subtly and gradually worsen your vision over time through several mechanisms. Firstly, chronic hypoxia, or persistent oxygen deprivation, can lead to corneal swelling and the growth of those abnormal new blood vessels, called neovascularization. If these vessels grow into your central visual area, they can directly obstruct or scatter light, resulting in a permanent reduction in your vision. Secondly, corneal warpage, the gradual reshaping of your cornea from ill-fitting or overworn lenses, creates an irregular surface. This irregular astigmatism causes distorted, blurred, or ghosted vision that may not fully resolve even after you stop wearing lenses. Thirdly, corneal scarring from infections, even minor or recurrent infections can leave small scars, or a severe infection can leave a significant one. These scars directly block or scatter light, leading to permanent and severe vision impairment. And finally, chronic dry eye, with its unstable or insufficient tear film, can cause fluctuating vision and, in severe cases, surface damage to the cornea that impacts overall clarity. It's important to clarify the relationship between routine contact lens wear and other common eye conditions. First, let's address glaucoma. Routine contact lens wear does not directly cause glaucoma. Glaucoma is a condition typically linked to high intraocular pressure damaging the optic nerve. However, there are indirect ways contact lens use can intersect. For instance, if a severe infection or inflammation inside the eye leads to conditions like uveitis, this inflammation can, in rare cases, cause a secondary form of glaucoma by affecting the eye's drainage system. For individuals already diagnosed with glaucoma, wearing contact lenses requires careful consideration, as many use daily eye drops, and lenses often need to be removed to apply drops, potentially impacting medication adherence. Some glaucoma medications also worsen dry eye, making lens wear less comfortable. Contact lenses can also temporarily alter corneal shape or thickness, potentially affecting the accuracy of intraocular pressure measurements. Additionally, some specialized contact lenses, like scleral lenses, have been shown in some studies to temporarily increase intraocular pressure in some individuals during wear. Continuing our discussion on glaucoma, it's interesting to note that research is active in developing smart contact lenses designed to continuously monitor intraocular pressure for glaucoma patients, and even drug-delivering contact lenses that can release medication slowly. These advanced lenses are specifically engineered not to increase eye pressure, but rather to aid in its management or monitoring. Now, shifting to cataracts, contact lenses also do not directly cause cataracts. Cataracts are a clouding of the eye's natural lens, primarily due to aging, but also from injury, certain medications like corticosteroids, or excessive UV exposure. However, indirect links exist. For example, poor contact lens hygiene leading to severe eye infections and inflammation can, in some cases, accelerate cataract formation. Additionally, if steroid eye drops, which are known to cause cataracts with prolonged use, are prescribed for contact lens-related inflammation, the lenses can absorb the steroids and prolong their contact with the eye, potentially exacerbating this side effect. To help ensure the safe enjoyment of your contact lenses, strict adherence to proper hygiene and wear schedules is absolutely paramount. Let's recap the golden rules. First, always thoroughly wash and dry your hands before touching your contact lenses or eyes. This is your first line of defense against harmful microorganisms. Second, ensure proper cleaning and disinfection. Use only fresh, commercially prepared contact lens solution recommended by your eye care professional. Never, and I mean never, use tap water, saliva, or homemade saline solutions for cleaning or storing your lenses. These are incredibly dangerous. Third, adhere strictly to your wear schedules. Never wear your lenses longer than recommended, whether they are daily, bi-weekly, or monthly. And fourth, Never sleep in your lenses unless it has been explicitly prescribed for extended wear by your eye doctor and you are regularly monitored. Sleeping in lenses dramatically increases the risk of serious infections. Continuing with our golden rules for minimizing risks. Fifth, replace your lenses and lens cases regularly. Replace your lenses exactly as prescribed, and your lens case at least every 3 months. Make sure to clean the case after each use and allow it to air dry. This prevents the buildup of harmful biofilms. And sixth, a critically important rule, avoid water exposure. Do not swim, shower, or use hot tubs while wearing contact lenses. We've discussed this before, and we'll delve into the specific dangers of water exposure again shortly, as it's a significant area of risk for contact lens wearers. Now, let's revisit and reinforce a critical warning: contact lenses and water exposure. It is strongly advised by eye care professionals, the FDA, and the CDC to completely avoid exposing contact lenses to any type of water. This includes swimming pools, oceans, lakes, rivers, hot tubs, showers, baths, and even tap water for rinsing or storing lenses. The consequences of ignoring this rule can be severe and vision-threatening. Why is water exposure so risky? Firstly, water, especially natural bodies of water, and even treated tap water or chlorinated pools, can harbor countless dangerous microorganisms, including bacteria, viruses, fungi, and parasites. The most notorious is acanthamoeba, a microscopic amoeba that can cause a rare but devastating eye infection called acanthamoeba keratitis. Contact lenses can act as a trap, allowing these microbes to adhere to the lens surface and then transfer to the cornea, where they can cause infection. Secondly, chemical irritation. Chlorine and other chemicals in pool water can bind to soft contact lenses, causing significant irritation, redness, dryness, and discomfort. These chemicals can also alter the lens shape or cause them to stick tightly to your eye, making removal difficult. Continuing why water exposure is so risky. Thirdly, there's lens swelling and discomfort. Soft contact lenses are designed to absorb water, and when exposed to pool or natural water, they can absorb additional water, causing them to swell, change shape, become ill-fitting and uncomfortable, and even lead to blurred vision. Fourthly, there's the risk of lens displacement or loss. Water pressure and movement, especially during diving or vigorous swimming, can easily dislodge or even wash out contact lenses, leading to immediate blurry vision or lost lenses. This is particularly true for smaller, harder rigid gas permeable lenses. And finally, compromised tear film. Swimming can wash away your natural tear film that lubricates and protects your eyes, exacerbating dry eye symptoms and making your eyes more vulnerable to irritation and infection. Given these severe risks, the safest recommendation for contact lens wearers is to completely avoid wearing contact lenses while swimming. However, if clear vision is absolutely essential for swimming, for competitive swimmers, water sports, or safety reasons, then strict precautions are paramount. The most highly recommended and safest option is to use prescription swim goggles. These provide clear vision underwater and create a sealed barrier, effectively keeping water and contaminants away from your eyes and contact lenses. If wearing contact lenses for swimming is truly unavoidable, daily disposable lenses are the preferred last resort. The crucial recommendation here is to discard them immediately. After swimming, do not try to clean or reuse them, even for a short period. This eliminates the need for disinfection after potential contamination and ensures you start with a fresh, sterile pair. This might mean using one pair specifically for swimming and another fresh pair for the rest of your day. Continuing our recommendations for swimmers. Using reusable lenses, like 2-week or monthly lenses, for swimming is generally discouraged, even with goggles, due to the risk of microleakage and water absorption. If this cannot be avoided, you must remove them immediately after swimming and perform a thorough rub and rinse disinfection process with fresh, sterile solution, followed by the full recommended soaking time, usually overnight. Some eye care professionals might even recommend discarding reusable lenses after a single swimming session if they were exposed to water, regardless of their scheduled replacement. Always use fresh solution, never top off. Also, consider giving your eyes a break by wearing glasses for a few hours or the rest of the day after swimming, especially with reusable lenses. Regardless of the lens type, if you choose to wear contact lenses while swimming, always wear high-quality, tight-fitting swim goggles to provide a physical barrier, but remember, goggles aren't foolproof. And finally, even with goggles, avoid opening your eyes underwater if you're wearing contacts. Most importantly, seek professional advice. Discuss your swimming habits and needs with your eye care professional. They can provide guidance on the safest options for you, which may include prescription swim goggles, daily disposables, alternatives like orthokeratology, which reshapes the cornea overnight, or even discussing refractive surgery like LASIK for a permanent solution if you're a very frequent swimmer. Moving beyond risks, let's talk about how to properly select contact lenses. This is a crucial decision that goes far beyond simply knowing your eyeglasses prescription. Remember, contact lenses are medical devices that interact directly with the delicate surface of your eye. An improper fit or the wrong material can lead to discomfort, poor vision, or even serious eye health complications. Therefore, the selection process should always involve a qualified eye care professional, whether that's an optometrist or an ophthalmologist. This isn't something you should ever attempt on your own. The most critical first step in contact lens wear is a comprehensive eye exam and fitting. You cannot, and should not, buy contact lenses without a valid prescription from an eye care professional. It's important to understand that a contact lens prescription is different from a glasses prescription. It includes specific measurements and parameters related to the contact lens itself, not just your refractive error. During this exam, your eye doctor will thoroughly assess your overall eye health, looking for any underlying conditions that might affect your ability to wear contacts safely. They'll precisely measure your eyes, including the curvature of your cornea, which determines the lens's base curve for a proper fit, and the diameter of your iris and pupil. They'll also evaluate your tear film, as a healthy tear film is vital for lens comfort and preventing dryness. If you have dry eyes, specific lens materials or treatments may be considered. Continuing the contact lens exam and fitting process, your personal input is vital. Your eye doctor will discuss your lifestyle and needs, asking about your daily activities, how often you plan to wear contacts, your tolerance for cleaning and maintenance, and any specific visual demands you have. Based on all these factors, your doctor will select initial trial lenses. You'll wear these for a period, from minutes in the office to a week at home, to assess comfort, vision, and how the lenses interact with your eyes. The doctor will also observe the lens movement on your eye. One or more follow-up appointments are typically required to ensure the lenses are performing well, your eyes are healthy, and you're comfortable before a final prescription is issued, especially for new wearers. And for first-time wearers, the doctor or their staff will provide detailed instructions on how to safely insert, remove, and care for your contact lenses. Once you're cleared for contact lens wear, your eye doctor can help you choose the best type based on several factors, starting with the lens material. Soft contact lenses, made of hydrogel and increasingly silicone hydrogel, are the most popular due to their comfort and ease of adaptation. Silicone hydrogel, in particular, allows significantly more oxygen to reach your eye, which is vital for health. While comfortable, they can absorb pollutants and require diligent cleaning unless they're daily disposables. They're great for most active individuals seeking daily wear convenience. On the other hand, rigid gas permeable, or RGP, lenses are hard contacts that offer remarkably sharper vision, especially for higher astigmatism or irregular corneas. They provide excellent oxygen flow, are very durable, and resistant to deposits, often making them more cost-effective long-term. Some are even used for ortho-K, to reshape the cornea overnight. However, RGPs require an adaptation period due to initial discomfort, are smaller, and can dislodge more easily. They are an excellent choice for those prioritizing very crisp vision or with specific corneal conditions. Beyond traditional soft and RGP lenses, we also have specialized options. Hybrid contact lenses aim to offer the best of both worlds. They feature a rigid gas-permeable center for crisp vision, combined with a soft lens skirt for enhanced comfort. While they offer a great solution for some, they do involve a more complex fitting process and can be more expensive. They are well suited for individuals with astigmatism or mild corneal irregularities who find traditional RGPs uncomfortable but need better vision than soft lenses can provide. Then there are scleral lenses. These are large-diameter rigid gas-permeable lenses that are designed to completely vault over the entire cornea, resting instead on the sclera, the white part of your eye. This unique design creates a fluid-filled reservoir over the cornea, offering exceptional comfort and vision correction for very complex conditions. However, their fitting is quite complex, they come with a higher cost, and require specific handling techniques. Scleral lenses are primarily used for severe dry eye, advanced keratoconus, post-surgical corneal irregularities, or for very high prescriptions where other lens types just aren't effective. The wear schedule, or modality, is another critical factor in lens selection. Daily disposable lenses are the most hygienic option, as you use a fresh pair every day and discard them, eliminating the need for cleaning solutions. They carry the lowest risk of infection and are excellent for those with allergies, dry eyes, or busy lifestyles. The main con is that they can be more expensive in the long run. They are often recommended for most people, particularly those with allergies, dry eyes, or a history of infections. Frequent or planned replacement lenses, such as 2-week or monthly lenses, offer a more cost-effective option than dailies. They provide a good balance of hygiene and value, but they do require daily cleaning and disinfection with solution and a lens case. If not cared for properly, they carry a higher risk of deposit buildup and infection compared to dailies. They're a common choice for those who want to balance cost and convenience. Continuing with wear schedules, extended wear lenses are designed to be worn continuously for several days or up to 30 nights, depending on the lens type and individual eye tolerance, offering maximum convenience. However, they come with a significantly higher risk of serious eye infections, such as microbial keratitis, due to reduced oxygen to the eye and increased exposure to microbes over prolonged periods. This modality requires strict adherence to recommended wearing schedules and very close follow-up care with your eye doctor. These lenses are only suitable for select individuals whose eyes can tolerate them, after thorough discussion and close monitoring by an eye care professional. Many eye doctors, in fact, advise against sleeping in any contact lenses due to this increased risk of complications. When selecting lenses, your specific vision correction needs are paramount. Spherical lenses are the most common, correcting general nearsightedness or farsightedness. If you have astigmatism, an irregularly shaped cornea, you'll need toric lenses, which have different powers in different meridians to correct the uneven focus. For those experiencing presbyopia, or age-related difficulty focusing on near objects, multifocal or bifocal lenses allow for clear vision at multiple distances, near, intermediate, and far, all within the same lens. These may require some adaptation time. Beyond correction, lenses can also come with special features. Some offer UV protection, which is a good supplementary layer but never a substitute for high-quality sunglasses. Handling tints are light tints that make the lenses easier to see. Then there are cosmetic or color lenses, designed to change your eye color. Here's a crucial note: cosmetic contact lenses, even if non-corrective, are still medical devices and require a prescription and professional fitting to ensure safety and proper fit. Never buy them from unverified sources. Lastly, while budget is a factor, it should never be the primary driver. The healthiest and safest option for your eyes should always take precedence. It cannot be stressed enough, attempting to select contact lenses on your own, such as buying them online without a current prescription and professional fitting, is extremely dangerous. Your eye care professional performs critical steps that online vendors or over-the-counter sales simply cannot. Only an eye doctor can take the precise measurements of your corneal curvature and other vital eye parameters necessary for a proper fit. They conduct a thorough eye health assessment to identify any underlying conditions that might make you unsuitable for contact lens wear or require a special lens type. They also carefully evaluate the lens fit on your eye, verifying that the lens moves correctly, allowing for proper tear exchange and adequate oxygen flow to your cornea. Beyond the initial fitting, they provide essential follow-up care to ensure long-term comfort and health. And if you ever experience issues, your eye doctor is there to diagnose the problem and offer effective solutions. Their expertise is invaluable for your ocular health. Wearing contact lenses necessitates significantly more frequent and specialized eye exams compared to not wearing them, due to the inherent risks and ongoing monitoring required for your eye health. For most contact lens wearers, a comprehensive eye exam is essential at least once a year, or every 12 months. This annual visit typically includes a specific contact lens exam component in addition to your general eye health check. Why is this annual requirement so important? Firstly, even with meticulous hygiene, contact lens wear increases the risk of serious eye infections, and early detection is crucial to prevent severe, irreversible vision loss. Secondly, it's vital for monitoring corneal health. Lenses act as a barrier to oxygen, and while modern lenses are breathable, chronic oxygen deprivation can lead to subtle changes like corneal swelling or the growth of new blood vessels, which often develop silently but can impact vision if left unaddressed. Thirdly, the fit and comfort of a contact lens are critical. Your eye's shape can subtly change over time, and annual evaluations ensure the lens continues to fit properly. Continuing our discussion on why annual exams are essential. Fourthly, vision can fluctuate, and an annual exam confirms your contact lens prescription is current, providing optimal visual acuity and helping prevent eye strain. Fifth, new lens materials and solutions are constantly evolving, and annual visits allow your eye care professional to recommend the best options for your eyes and address any sensitivities or incompatibilities. Finally, these visits allow your eye doctor to reinforce proper lens care habits and discuss any issues or shortcuts patients might be taking, which significantly increase risk. Now, while annual exams are the standard, several situations warrant even more frequent visits. This includes new contact lens wearers or those switching to a significantly different type of lens, where multiple follow-up appointments are often required. Also, specific lens types and wearing schedules, such as extended wear lenses, which carry a significantly higher risk of complications, often require more frequent checkups, sometimes every 6 months. Specialty lenses like toric, multifocal, or scleral lenses also demand more precise fitting and ongoing monitoring. Continuing with situations that require more frequent eye exams for contact lens wearers. Thirdly, the presence of underlying eye conditions significantly impacts exam frequency. If you have chronic dry eye, allergies, a history of recurrent infections or inflammation, or corneal irregularities like keratoconus, you may need more frequent exams to manage your symptoms, adjust lens types or solutions, or closely monitor any changes. Fourthly, and critically, if you are experiencing any concerning symptoms or discomfort, such as unusual redness, pain, discharge, extreme light sensitivity, or sudden vision changes, you should remove your lenses immediately and contact your eye care professional without delay, regardless of your last scheduled exam. This is a crucial, unscheduled visit. Persistent discomfort, even if not an emergency, also warrants a visit to find a better solution. Finally, systemic health conditions that affect the eyes, such as diabetes or certain autoimmune diseases, can increase your risk for various eye complications exacerbated by contact lens wear, often necessitating more frequent, often annual, exams to monitor overall eye health. In conclusion, contact lenses offer unparalleled freedom and convenience for vision correction, truly revolutionizing the lives of millions. However, these profound benefits come with an equally profound responsibility. The overarching message is clear: diligence is key. This means strict adherence to proper hygiene, recommended wear schedules, and consistent professional oversight are not merely suggestions, but absolute necessities. Neglecting these golden rules, particularly regarding water exposure and overwearing your lenses, significantly escalates the risk of severe and potentially irreversible damage to your vision. Regular, comprehensive eye exams, often annually or more frequently based on your individual circumstances and lens type, are your frontline defense. These professional assessments are vital because they can detect subtle changes before they become critical problems. So, remember, should you ever experience any unusual eye redness, pain, discomfort, discharge, extreme light sensitivity, or a sudden change in vision while wearing contact lenses, remove them immediately and contact your eye care professional without delay. Prompt action can make all the difference in preventing severe and permanent vision loss, ensuring you can continue to enjoy the benefits of clear, healthy vision for years to come.